Welcome. My name is Richard Skolnik, and as you can see from the background, because of the pandemic, I'm not speaking with you from Yale University, where the other sessions were recorded, but I'm actually speaking with you from my home in the state of New Mexico, in fact, in northern New Mexico, in the United States. Today, what I'd like to do is talk with you about COVID, but I'm not going to talk with you about cases or hospitalizations or death or the way the pandemic has evolved over time. These are all things with which I'm certain you're very familiar. Rather, what I'd like to do is talk with you about COVID as what I call the quintessential global health problem, a global health problem that reflects, as well as any, in many respects, we could say, sadly, all of the critical issues in global health. So let's begin. I want to go back, if I might, to the beginning of the course. And among the first things that we talked about was why it's so important that we care about global health. And I mentioned, among others, the 5 points that are noted here. First, an expression I'm very fond of and try to remind people of all the time, and that is that the health of anyone, anywhere, is the health of everyone, everywhere. Second, I remind people, many of whom don't seem to understand this nearly as well as they should, of the exceptionally powerful links between health and productivity. It's also important that we remember that global health is related to a range of concerns about ethics and about equity. That global health issues also raise a number of matters concerning security and freedom, and certainly central to everything global health is the need for cooperation. These were highlighted very early on in the course, again, as important points about global health and why we should care. And what I'd like to do now is delve a little bit into each of these and show how it is that COVID relates to them. So first, when we're thinking about the health of anyone, anywhere being the health of everyone, everywhere, we should all be familiar, of course, with the fact that COVID, once it emerged, spread very, very rapidly. Apparently, it emerged in China, and it wasn't very long before there were pockets, large pockets, of COVID in Europe, especially in Italy. And before too long, we in the United States had COVID, and so did practically everyone else. And by the way, as I'm sure all of you know, COVID-19 is the official name of the disease that's caused by a virus. But for the sake of simplicity, throughout this discussion, I'm generally going to just talk about COVID. So again, COVID is a remarkable manifestation of the extent to which a health problem can begin, and in very, very short periods of time, it can involve the entire world. We've seen the same with variants. Variants of the virus that causes COVID-19 have arisen, such as Delta and now Omicron, and it took very, very little time. First, before they spread from one country to another. For example, Omicron is thought to have arisen in South Africa. It's now not much later, the primary variant in the country in which I live, the United States. So these variants have spread from country to country. And then within countries, even large countries like my own, these variants have spread very, very quickly as well. And we know that even when there are travel restrictions, and other efforts are undertaken to try to keep viruses like this one from spreading, we know that it's almost impossible to control them. And again, I can't think of a better manifestation, however much we wished it could be avoided, of the importance of the notion of the health of anyone, anywhere being the health of everyone, everywhere, than this COVID-19 and the virus that causes it. And when we're thinking about that, we have to ask ourselves, and we'll come back to this when we talk about equity, is it even imaginable that any country can protect itself from the further spread of the virus in a world where such a large part of the world is still not protected? Most of the high-income countries, as you know, have already achieved a relatively high rate of vaccination against the disease, and yet most of the low-income world remains largely unvaccinated. So I think we understand well the interdependence of the world. We understand well the extent to which infectious diseases can spread. And again, if we ever needed a reminder of this, COVID is certainly an exceptional one. I'm always disappointed by the extent to which so many people worldwide have not understood the important links between health and productivity. And again, COVID has highlighted this in remarkable way after way after way. Look, for example, at the days lost to illness, to quarantine, and to isolation. Look at the extent to which people who could be out earning are not able to earn. Look at the days lost to shutdowns and lockdowns, as they call them in some countries. There are an immeasurable number of workdays that have been lost within communities, within countries across the world, due to the shutdowns that were imposed to try to mitigate a COVID and get us to a level at which it would either be gone or with which we could live with it. In fact, 6 months into the pandemic, estimates were made of the economic losses in the United States, and they suggested that only 6 months into the pandemic, that the economic losses to the US had already amounted to 16 trillion US dollars. The pandemic has now gone on for 4 times longer than that. And as we all know, the economic consequences of this have been just extraordinary. And then if we factor into this, the costs of care, the costs of hospital stays, and the costs of death and of income foregone from people who died prematurely, the estimates of losses from COVID become even more enormous. They're probably almost, we could almost say they're incalculably large. They're immeasurably large. And yet, again, so many people have failed to understand the link between getting sick, not being able to work, dying prematurely and losing that income, the cost to societies of all of these put together. And COVID, certainly better than anything else in our modern lifetimes, has reminded people we have to be extraordinarily sensitive to the costs of ill health at the individual level, at the family level, at the community level, at the national level, at the global level. And if more and more people understood this, they might, I hope, be willing, for example, to spend money on public health. If $16 trillion was going to be your losses, for example, in principle, any expenditure less than that would have paid a positive rate of return. In addition, in a way we really haven't seen before, what I would call the second order effects of COVID have led to dramatic shortages of products, extraordinary difficulties in moving products from one place to another, shipping problems, transportation problems. And as I speak with you, for example, 3 subway lines in New York City are closed because so many of the people who work in the subway system are sick, absent from work, and unable to do their work, that the only alternative for New York City was to actually close these subway lines. Many schools, as I mentioned before, are closed because of teacher absences, even if the rates of infection among their students are not yet that high. So it doesn't take that much, I think, generally, It shouldn't take that much to understand the links between health, the economy, productivity. But if we ever needed an example to remind us, COVID is certainly one. COVID has raised an enormous array of ethical and equity concerns that are always central to public health and to global health. Is it ethical to ban travel from one place to another? The Australians even prevented some of their own citizens from returning to the country. What are the ethics and what have the ethical implications been historically of efforts to quarantine and isolate people? What is it ethical to tell people they must wear a mask, either when they are in indoor environments like supermarkets or when they go to school? Is it ethical, and what does the history of ethics and public health tell us? Is it ethical to mandate that certain people be vaccinated against this? And then, as you know, many hospitals in many countries have been absolutely overwhelmed by COVID patients and have therefore resorted to what we call crisis standards of care. And those crisis standards of care are basically a legal, forgive my layperson's way of saying this, but they're basically a legal framework for rationing care. And in some respects, deciding who gets care that they need and who unfortunately can't get it. In some respects, who lives and who dies. What are the ethics of that? So if we needed an example of a global health problem that provided us a basis for thinking about all of the critical issues in ethics, I can't think of a better one than COVID. COVID has also raised an enormous array of equity concerns. Using my own country, the United States, as an example, throughout the pandemic, there have been questions of the extent to which different groups of people within the United States were infected. And what we found that more marginalized groups, such as African Americans, certain Hispanic American communities, Native American communities, generally had higher rates of infection than others. Why was this so? Well, much of this may have stemmed from issues related, for example, to the social determinants, their lack of ability to work from home in safe ways, their underlying conditions like diabetes or obesity, which affect so many, for example, of our Native American communities in New Mexico, lack of access to care of appropriate quality, discrimination and stigma. I mean, COVID pointed a big light to equity concerns in infection. And then once we began, for example, vaccinating people, this raised enormous questions as well about the equitability of approaches to vaccination. How can we ensure that everybody, without respect to their background, their location, or anything else, has an equal chance to be vaccinated? And the same will also be true of therapeutics. Therapeutics will certainly be more available in the United States, or are more available to some groups than they are to others. So there are a range of public and global health issues that raise equity concerns. And equity is central to everything in public and global health. But COVID, again, took a gigantic spotlight and shined it on a range of equity issues, not only in my own country, but really throughout the world. It also shone a gigantic spotlight on equity issues across countries. And again, in some respects, vaccination is the big one. As soon as it was clear that vaccines would be available, most high-income countries did everything they could to order as many vaccines as they could possibly order for what they thought they would need to vaccinate their own people. And yet most of the low and some of the middle-income countries found themselves kind of locked out of the market. And what we're looking at today is a world, as I mentioned before, where the rates of vaccine coverage in the high-income countries tends to be quite high, and the rates of vaccine coverage in the lowest income countries is almost negligibly small. Is this fair? Is this equitable? It's probably not. It's not equitable. It's not fair. But of course, as all of you are already thinking, it also makes no sense for the reason I also mentioned a few minutes ago, which is if the health of anyone anywhere is the health of everyone everywhere, then it's also in our health and technical interest to ensure that everybody in the world who should be vaccinated is vaccinated as rapidly as possible in order that the virus that causes COVID-19 can be reduced as much as possible and in the fairest possible way across countries. The notion of health being tied with equity, security, and freedom first came up with HIV. When people thought about the possible impact of HIV on workers in education, workers in health, military personnel, et cetera. And we haven't talked that much about it since then. But when you look around at the political and other ramifications of COVID and the lockdowns associated with it, I think one has to raise again some of the important relationships between global health issues and ties with security and freedom. We've seen all sorts of political manifestations in my own country resulting from unhappiness among certain groups of people with vaccine mandates, mask mandates, lockdowns, shutdowns. But it's not just in my own country. Even in the Netherlands recently, for example, there were major political manifestations. There were riots in the Netherlands recently over lockdowns, shutdowns, and some of these mandates as well. COVID and the vaccine for it has been politicized in a number of settings. And so that in addition to the normal vaccine hesitancy that we might see in high-income countries and the normal vaccine hesitancy we might see in low-income countries, what we've really seen is the COVID vaccine as a lightning rod, or the vaccines as lightning rods, which have helped to heighten anti-vax attitudes in a number of settings and further created political divisions, political cleavages between certain groups of people, certainly in my own country, but this isn't the only one in which that's occurring. And then I think we really have to ask ourselves about the security and freedom implications of the fact that in 2020 and parts of 2021, and even continuing in some places, so many children worldwide did not have a chance to go to school physically. Many didn't even have a chance to go remotely. Some of the remote instruction really wasn't nearly an equivalent for schooling where they would be physically present. And in some countries, at least in some groups of young children, we really risk the possibility that they've lost, and perhaps even irrecoverably, some of the knowledge, skills, behaviors they would have gained if they've gone to school. Surely, if that's the case, it has important manifestations and implications for security and freedom. And also, we risk the possibility of turning the clock back on important progress in health services, especially, for example, in childhood vaccination. When I wrote the first edition of my textbook in 2007, measles was the third leading cause of child death in the world. As I worked on the fourth edition a few years ago, measles was the 31st cause of child death. And I believe, forgive me if I'm wrong, that there were then fewer than 200,000 measles deaths among under 5 children in the world every year. Almost all should never have occurred, but dramatic progress in the fight against vaccine preventable diseases in low and middle income countries, as all of you know, and as we talk about in the course. And yet COVID has caused real setbacks in the provision of health services, including in that area of childhood vaccination in which so much progress had been made. Can this be recovered? How long will it take to be recovered? And what will there be irretrievable losses in the health of children that then redound on security and freedoms in the countries in which they're living? no one should need a reminder of the extent to which COVID highlights the importance of cooperating globally. The many questions were raised about SARS when it first emerged and the extent to which the world got when it needed the information to understand SARS and deal with it as it spread. Many questions have also been raised about the origins of this virus and whether or not the world got in a timely way the information it needed to address it. But certainly for a disease that's spreading worldwide, it's unbelievably critical that all countries share in real time the information they have about the presence of the disease, the type of variants, who's getting it, et cetera. So we know that surveillance is extraordinarily important. But again, if we needed a reminder, which I hope we wouldn't, COVID has certainly been an unbelievable reminder. There's a lot of scientific work that goes along with understanding the virus and the spread of the virus within and across countries. And one type of this scientific work has to do with sequencing, with deciding on the variant, et cetera. This is something very few countries can do this on their own. And in any case, because different variants may emerge at different times and play out in different ways, I put the word sequencing here as really a proxy for scientific sharing, scientific cooperation, which is just as fundamental as the sharing of information about surveillance. What's best practice? Just think what happened when Italy was first overwhelmed by cases of COVID, particularly among its elder citizens. This was new. Our Italian friends were learning as they went along what were the best approaches to the clinical care, who was likely to be most affected, what was the extent to which one needed to pay particular attention to older people, to nursing homes, how could one do that, et cetera. Best practice has to be developed universally. There are certainly things that are local and that have to be adapted. But it's critical that we understand, what did our Italian friends learn? What did they learn as they went along in the care and treatment of people with COVID? What have our friends in South Africa learned? What have our friends in Cote d'Ivoire learned? What have our friends in Chile, in Argentina, and Guatemala learned? And it's really fundamental, if we're going to learn the lessons of experience, that these experiences be shared globally. It's also true that there may be some countries that have the scientific wherewithal and the financial wherewithal to develop diagnostics, vaccines, and therapeutics. But it's certainly also true, as we've talked about in the course and throughout the course, that this is an area that requires sharing of information across countries in real time. And the more that such information is shared freely, the more it is that scientists throughout the world can cooperate in the most rapid possible development of diagnostics, vaccines, and therapeutics. This occurred in relatively rapid time for COVID, and I'm not going to talk about how that happened, but it's certainly true that we need to see cooperation within across countries as rapidly as possible in real time if we're going to get diagnostics, vaccines, and therapeutics developed as the need for them evolves with the spread of this virus or the next one or the one after that. It's also true that it's pretty clear that, as I mentioned when I talked about equity, that the approach the world took to the purchase of vaccines has been an extraordinarily inequitable one, a highly unfair one that has left the high-income countries with lots of vaccines and the low-income countries with few. And so relatively early on in the pandemic, the world got together and created, under the auspices of the Global Alliance for Vaccines and Immunization, Gavi, a global mechanism, the aim of which was to try to get vaccines as rapidly as possible to countries that would otherwise have difficulty accessing the market or paying for it. This has not worked as well as planned. although it's done lots of good work, and some of the challenges to it further highlight the extraordinary importance of working together to deal with global health issues that affect all of us, again, for which there can't be a better example than COVID. So let me end, not really by talking about the lessons of COVID broadly, again, about which you can read in many, many places from people who are far more expert than me, but let me end by thinking about why global health is so important, the comments that I've just made, and what are some of the lessons that we really need to take to heart in that context. One, and these are all matters that are covered in other places in the course, but which COVID highlights the importance of. First is, it's never too early and it's almost always too late to prepare for the next pandemic. Everyone has said, working in global health, has said for years that this could happen, and yet almost no country was prepared to deal effectively with COVID. Many countries are still not prepared to deal effectively with COVID. And a new global health and security index was just put together that suggested that no country is prepared to deal with the next pandemic. COVID has highlighted for all of us the extraordinary need for pandemic preparedness, for which there are no substitutes. And it's not just pandemics. COVID has also highlighted the need to get ahead of other potentially grave threats that could affect all of the world and do affect all of the world, such as antimicrobial resistance. You'll remember from elsewhere in the course that this is an area on which there's really not been sufficient progress. And the world has done better than 20 years ago, but not nearly well enough to protect us from what would happen if we wound up with a really grave, the really grave presence of a rapidly spreading microbe, which was resistant to the antibiotics that we have. COVID has put many spotlights on the exceptional weaknesses of health systems in many countries and the exceptional weaknesses of public health in many countries. Public health in many countries has always taken a back seat to clinical care and to other investments in other areas. I think we've learned, I hope we've learned, that this is really foolish. That if you were looking for a sound public investment, that effective and efficient investments in public health can provide extraordinarily high rates of return. And the failure to make such investments can leave you facing the enormous economic consequences that so many countries face from COVID. We should never let this happen again. But I can't guarantee that that political leaders throughout the world have learned this lesson nearly as well as we should have. And my own country, almost uniquely among the high-income countries, is a terribly fragmented health system. And that has exacted an enormous toll on our ability to deal with COVID, from the lack of health insurance among some people, the remarkably disorganized approach that we've taken to testing and different types of testings, the lack of uniformity in the availability of care, the extent to which the pandemic has played out in the United States in highly inequitable ways. So again, COVID has highlighted this. And in any country where systems are weak and fragmented, COVID has reminded us of the exceptional importance of having a strong health system that works in effective, efficient, doable, sustainable, and fair ways. COVID has reminded us that it's not good enough to respond to things when they happen. We talked when we discussed science, technology, and public health about advanced market commitments. But I think we know now that even when you're operating in record time, like the development of vaccines for COVID, it's really in many respects not good enough. And one of the lessons for pandemic preparedness should be the development of mechanisms that allow the most rapid development of diagnostics, vaccines, and therapeutics, as well as the most rapid development of cooperative mechanisms like COVAX for getting these things out to the world as rapidly as possible and in the fairest possible ways. Messaging around COVID in many countries, especially my own, has been, to be polite, a complete mess. It's been inconsistent, it's been irregular, it's been confusing. We've had political leaders like in my own country and like, for example, in Brazil, who in many respects downgraded and downplayed the pandemic, both globally and within their own countries. We have political leaders who've spoken against vaccines, or at least haven't done very much to support them. We've had public health authorities who've had very great difficulties providing the public with clear, simple, regular messages available and understandable to all that could help us respond at the family, community, national, and international level to COVID. COVID has reminded us of the centrality, how incredibly fundamental it is to remember there are people involved, and we need to be speaking with each other and speaking with them and messaging in ways that are clear and simple and helpful. And finally, again, and this came up, of course, with influenza, it came up with Ebola. Again, COVID reminded us that we need to think very hard about the way the world works with and through the World Health Organization as the premier global body for addressing health concerns. WHO has tried to respond to COVID, and I'm not going to comment critically one way or the other on its performance, but again, COVID has highlighted the extent to which if WHO is to operate in effective and efficient and fair ways globally, it needs to have a constant, understood source of financing that doesn't understand on extra budgetary approaches. It needs to have the authority to act. It needs to be able to, the international health regulations need to enable that. And if those things aren't addressed quickly, effectively, and efficiently, there will continue to be substantial limits on the way the World Health Organization can do its work. So I want to thank you for giving me an opportunity. Some years after the core videos have been made for this course, of speaking with you about COVID and about the extent to which COVID, as well as anything we've ever faced or could probably imagine, has highlighted for us the critical importance of global health and some of the critical concepts behind why global health is important. So I wish you all well. I thank you again, and I'll look forward to seeing you in the near future as well.